My name is Miami. I'm about to go to high school next year. And I like to listen to music and have some quiet space once in a while. So I got diagnosed at 13 and it was a bit of a shock because since my mom has heavy bleeding, I thought it was just normal to just bleed this heavy and feel like a little anemic every once in a while. It was impacting my school life a lot because I would just fall asleep.
She was really weak and the teachers thought she was just not paying attention, just didn't care about her losing so much blood. She would bleed for 10 plus days. It wasn't normal. Nationwide Children's Hospital, when they said, okay, we have these 2 doctors we only want you to see. Every question I had, she answered and above.
So what we found when we did laboratory testing for Miami was that she has type 1 von Willebrand disease, which is one of the most common bleeding disorders that we diagnose in our clinic.
Meeting Miami is the moment that crystallizes why you became an adolescent medicine doctor, why you're passionate about what you do, because she just wanted help. She wanted to feel normal, and mom just wanted to not feel so helpless about what was happening with her child.
Miami exemplifies so many of the issues we face in trying to take care of these patients. Patients and families aren't aware of what normal menstrual bleeding is, so they don't know how to identify abnormal bleeding. How do we educate families and how do we teach primary care providers to quickly assess what's happening with menstrual bleeding?
If she landed someplace that did not understand the importance of research, there was a connection with our Young Women's Hematology Clinic, and then she was able to get specific treatment, she could land in the ER somewhere, and because of her race and ethnicity, somebody could assume either she was pregnant or either she had a sexually transmitted infection and gloss over her impressive bleeding disorder history.
I think the other part of Miami's journey that is similar for patients with bleeding disorders is that the first treatment is not always the right treatment. When Farida walks into a patient room, she carries a basket as all the different types of treatment you can use for heavy menstrual bleeding. She's not going in there with an agenda. Asking them, what are you most worried about? Is it the bleeding? Is it the pain? Is it being able to not miss swim practice?
I want her to be a kid and go swimming. I don't want her to go through what I went through. I wish I could just take all her pain away, but I can't.
I'm just so glad that we met her when we did, because now she'll be going to this new school with much better energy, much better ability to focus on her schoolwork, and also not having that anxiety about leaking onto clothes at school, things like that.
The main things I want to do when I grow up is either take in dance, theater, or singing. I'm actually thinking of joining a swim team, since swimming has always been a happy place for me.
I think being part of the network of these clinics within the Foundation for Women and Girls with Blood Disorders makes people feel like they're part of a community. They're not the only ones struggling with these issues. And our patients understand that many of their peers are going through similar issues. I feel proud that we've helped kind of set her up for success as she starts this new chapter with her education.